Thank you all for attending. I'm really excited to be talking to this group of amazing professionals. I just have on here my contact information. If any of you would like to receive a copy of this presentation or to even receive any emails about any trainings and retreat dates that may be coming up, feel free to just shoot me an email and I'll make sure to get all that information to you. Maybe I'll mention it again at the end as well, because I know a lot of people are still signing in. So, all right. So again, my name is Catherine Warnock. I work at Mariposa Counseling Center. I'm located in Las Cruces, New Mexico, the land of enchantment. And I've been doing this work for about a year and a half now, with both retreats, as well as training opportunities for other practitioners. So today we're talking about psilocybin-assisted therapy. Just to get everyone on the same page, psilocybin is a classical psychedelic. It is considered a controlled substance in the United States. So I want to make that really clear. It is a Schedule 1. So I want to make it really clear, what does Schedule 1 drug mean? We've heard the term, but essentially really what it means is that there's no accepted medical use and that there's a high potential for abuse, both of which are completely inaccurate with psilocybin. There is, based on all of the research that's been done in the past 10 to 15 years, there is plenty of evidence that there is highly accepted use that's very effective, and I'll be talking more about that later. And I can tell you right now that psilocybin is not addictive at all. In fact, it will actually stop working if you take it too often or too much. You build a tolerance very, very fast. If you were to try to do mushrooms 3 days in a row, by the third day, you would feel absolutely nothing. So unfortunately, right now, it's scheduled completely incorrectly. I know that there are people and groups out there trying to make that change, but it may be a while, before anything does change. I do want to make it really clear that there are two types of psilocybin. There's the actual fungus, the actual mushroom, and then there's also a synthetic version that is used in a lot of the clinical trials. So, the way I kind of see that is it's, Big Pharma needs a way in, and I think that's pretty much going to be the way they get into this. They'll be offering it the synthetic form, which from what I understand is not as big of an experience as the actual mushroom. So even though it is considered illegal, it is decriminalized in basically the places that are listed here. I'm not going to go through all of these, but the big ones, obviously, that everybody's heard about is Colorado and Oregon. Those are the big ones right now. There is a lot of new legislature happening pretty much right now as we speak. In fact, in the past 3 or 4 days, there have been advances made in Illinois, Indiana, New Mexico, and Arizona. So it's really exciting that things are becoming there's more and more decriminalization happening. And so that is very, very promising. So psilocybin is the term that we use to actually identify the mushroom itself. It is a genus of guild mushrooms. They're grown worldwide, like all over the world. There's a variety of different strains, and right here what I'm showing you is both the version that's growing as well as a dried version. And there's 2 strains here that are probably the most common with psilocybin, and that's Mexicanus. Some of you may have heard of Maria Sabina in Oaxaca, Mexico. That is where that variety exists. And then obviously a lot of people have heard of cubensis. That's a very popular strain that has the psychoactive effects. So psilocybin and psilocin are 2 different components that are inside of the mushroom. So it's important to know that there's only over 200 species of psilocybin mushrooms that contain these psychoactive effects. So there's quite a bit of variety in the different versions. And in fact, some people are even becoming experts on, well, this particular strain is better for creativity versus this one is better for self-love. There's a lot of people doing this work right now to understand the different strains better. So what happens is psilocybin is the actual compound in the mushroom that our stomach acids digest down to psilocin. And psilocin is the chemical that will actually cross the blood-brain barrier. What you'll notice here is that psilocybin and psilocin look very similar to serotonin. And serotonin, as most of you know, is a natural neurotransmitter that we have in our bodies. And it actually will use the same exact receptors. So serotonin is a chemical that is basically carries messages between nerve cells throughout the brain and the body. And so psilocin and psilocybin actually will bind to the same receptors as serotonin. So that, I think, should tell us a little bit about how these drugs actually work and why they are so effective, especially for things like depression and anxiety. So what are the benefits? Well, definitely, if we could see the world like this picture here every day, that would be pretty amazing. But so this listed here are the reported benefits from clinical trials. There's a lot of different studies that are being done around specific conditions like PTSD, depression, anxiety, OCD. Definitely, it's making a huge difference with addiction, especially alcoholism. It will allow people to create kind of more of an open-mindedness, and not just during the session. These are the long-lasting benefits that are permanent after the treatment itself. A lot of connection with nature. One of the biggest things that people report is the loss of the fear of death. And this is really, really important for end-of-life capacities. What they have found is that end of life, especially people that have cancer that have qualified for a lot of the clinical studies, what they find is that after the treatment, they're completely okay with death. They actually are bringing their family in closer instead of alienating and detaching. It's actually a really beautiful thing. In addition, there's increased spirituality, increased authenticity, access to some of the more positive emotions in life, like joy, gratitude, awe, and compassion. Definitely gives people a stronger sense of meaning and purpose in life. And then having that motivation, it's kind of like an after effect. There's motivation to make different changes in our lives, things that are going to be healthier for us in the long run. So let's talk a little bit about the adverse effects, because I want to make sure that I give that equal billing. The really good news is there is no lethal dose of psilocybin. There's no known lethal dose. Any potential issues that have happened with psilocybin have all been related to other conditions, like cardiovascular issues. If you have severe cardiovascular issues, this is not going to be a drug for you. In fact, this medicine can actually make that condition worse during the treatment. So there are actual assessments that we do to make sure that not everybody would qualify for a treatment. But there is no known lethal dose, which is really good to know. Compared to other psychedelics, psilocybin has the least amount of seizures, hospital admissions, and other adverse effects reported. In fact, I'll show you some bar graphs on that here shortly. I already mentioned that it does not have addictive properties, so you really can't become addicted to mushrooms. This is what I usually will challenge people when they're frightened. They tell me, but I don't want to get addicted to it. And I usually will say, well, we don't really have mushroom rehab. Like, that's not really something that exists, because it's not something that people actually can be addicted to. Probably the biggest two things to be concerned about, if they do qualify, obviously, is physical safety can be an issue. That's why sometimes we hear anecdotal evidence of recreational use where people will do things like jump out windows. Well, obviously, when you're in a therapeutic environment and you're receiving therapeutic treatment, we're keeping everyone safe. We're making sure that none of those things will happen. We will even walk you to the restroom if you need to use the restroom, because we're going to make sure that everybody is safe at all times. The only other thing that could happen is there's a psychological risk, because it can be very uncomfortable dealing with our unresolved issues. The one thing that mushrooms will do is it doesn't always give you what you want, but it will always give you what you need. And sometimes that means looking at some hard things. So sometimes um, it can be an uncomfortable experience, but the overall outcome is usually very, very positive. I will just state on here that there's rare cases of psychosis reported. There have not been a single observed during clinical studies. This is all anecdotal evidence from like the 70s when it was used recreationally. So I actually don't really think that's an issue, but I put it on here because I'm trying to be fair and give all the information. So some people are really, really frightened of having a bad trip. And these are usually reported in really high doses in recreational settings. Now, for treatment, high hero doses, which is what is often referred to, is not necessary. And in fact, we don't go that high. A hero dose is usually around 5 grams or higher, and we try to stick between 3 and 4 grams. We're trying to achieve ego dissolution, which I'll talk about in a minute. So the other thing that can cause a bad trip is not having the proper set, setting, and matrix in place. So just really quick then to go back, I was thinking it might actually list them out, but set essentially is the beliefs around what's expected and what, do I believe that this medication is going to be helpful or not? Setting is your environment, who's there, who are the people, what is the place? And then matrix is where do they go home to? Are they in a supportive environment? Are they going to go home to somebody that's going to make fun of them for what they've done? That may derail the experience. So set, setting, and matrix are all very, very critical. We take those all very seriously. The other thing that can create bad trip is if you actually mix this with other drugs, especially alcohol. Alcohol and psilocybin do not go well together at all. Same goes for stimulants. And so even when people do say that they've had a challenging trip, they still do report growth and healing. I will say that the way that we do these retreats, we have optimized it to where people don't have bad trips. Bad trips are something that, like I said, usually happens in a recreational setting at high doses. Just for an example, if you're in a rave and you're on a psychedelic, and let's say your trauma is coming up for you, and people are bouncing into you, that would create a very distressing situation. So I can see how that could potentially create a bad trip. The therapeutic treatment that we do, obviously, we are not doing anything close to that. We're actually treating this very seriously, and it almost looks like a day in bed where we're just doing internal work. So here's an example. This is a really good study that was done in 2017 of all the different recreational drugs. And in fact, this is just a subset. But what you'll notice here is it's actually talking about emergency medical treatment. What was recorded based on all of these different recreational drugs? And you'll see here that the psilocybin, which is the magic mushrooms, is the lowest of any of the other drugs, as you can see here, which I think is very encouraging to know that it really doesn't pose risk or harm, not like some of these other drugs can do. And then here's a really good slide that was released by the US government, actually. I actually it says it's Britain, but I think the US government contributed to this study is more accurate. But what I want to show you here is it's showing harm to others and harm to self based on all of the different recreational drugs that are out there. And as you can see, mushrooms is the lowest incident of harm to self. Alcohol, interestingly enough, is the highest, but that's not surprising. So here's just some examples of the clinical trials that have been done. I've already mentioned some of these, but bipolar disorder, cancer-related depression, chronic pain, end-of-life anxiety. In fact, there's one happening now in San Francisco for end of life they're right now taking participants that I think it's supposed to start next month. It'll go for, I think the study will happen for at least a few months. So it probably won't be published for a few years, but it's really exciting to know that the work is being done. So Roland Griffiths, he was at Johns Hopkins University. And in 2008, he published basically a research study that actually, besides doing the original study, he then did another 14-month follow-up, and he evaluated the effects that people were reporting literally a year and a couple months later. And these were all people that had only had one administer of the medication, and none of them had experienced any psychedelic prior. And pretty much what most all of the participants rated it as being among the top 5 most significant experiences of their lives, including birth of a child, death of a loved one, marriage, etc. 64% of them also indicated that their sense of well-being and life satisfaction increased moderately or very much, which is very encouraging. And none of the volunteers rated the experience as having made it worse for them in any way, shape, or form. The one thing I do want to say about Roland Griffiths, he did a lot of amazing work with end-of-life cancer patients. And unfortunately, last year, he was diagnosed himself with cancer. He ended up passing away in October, but he was able to use this medicine to help him transition as well, which I think is really an amazing kind of part of that story. So let's focus on psilocybin for end-of-life care. So I went out and I did a bunch of research to see, like, what could I find specifically on end-of-life? Johns Hopkins have done some studies, and they are, if you just Google them, you can actually find these studies. And the results were phenomenal. Obviously, the state of Oregon and Colorado have decriminalized psilocybin. So that is a place where people can get care currently. Colorado, it doesn't have everything outlined yet, but there are people doing it, including myself. I am offering retreats in Colorado. You can also go to Canada. They actually offer special access for terminally ill. They will allow, it is a process though. So that's the one drawback, is that you do have to get approval. But they are allowing access, which I think is encouraging. There's another option here in the US, and that's the Right to Try Act. Not a lot of people have attempted to use this yet, but they are saying that as long as you have a life-threatening diagnosis, you've tried all of the treatments, you can't get into any of the clinical trials, then they're supposed to allow you to utilize medicines such as psilocybin. End of Life in Washington has released a policy statement that's on, if you just Google it, it's a pretty profound statement saying that they believe that more work needs to be done and psilocybin needs to be offered as an option for quality of life near the end of life. I was also really pleased to see that the Palliative Care Network of Wisconsin, they have a fact sheet that they've published advocating for this type of therapy. And then this is what I was talking about earlier, the University of California in San Francisco. They just started a study that they're getting participants for right now, which I think will be really exciting to see what happens with that. And then I also saw that in Missouri, there is a bill that has been submitted to the Senate for end of life care. So, this isn't much listed here. There isn't a lot being done yet, but it's a start. And I think that the more advocacy we do, which that's what I'm doing here tonight in trying to spread the word, hopefully we can continue to pressure legislature to get some things changed. So let's talk a little bit about how does psilocybin work? What's happening that's allowing it to be so profound, so amazing, so healing, and allowing so much shift and change? Well, essentially what it does is we have in our brains, we have something called the default mode network. It's a region of our brain that allows us to create habits. It allows us to basically develop an ego in which we use for protection and safety to navigate in the world. Habits are what allows us to be efficient and effective as humans. When we go to, for example, let's say we travel to a foreign country, we can't really rely on habits because everything's new and fresh. That's because we don't have anything to go by. We have no history there, right? Well, what happens when the default mode network gets taken offline is it gives us a very similar experience of newness, of freshness, of not relying on our habits and the old pathways that we usually use. To give you an idea about the default mode network, normal activity is linked to awareness of ourselves, social thinking and understanding about what other people are thinking and feeling. It also allows us to understand the past and the future. So the default mode network is a very critical part, that what makes us human, meaning a little bit more advanced than maybe other species, maybe when we compare ourselves to monkeys or something, or apes, upper primates. So when we're able to take this default mode network offline, that's when the power happens. So what they have found is that psychedelics, and psilocybin specifically, is one of the easiest ways to get the default mode network offline. So what this is showing you right here is basically what it looks like from, I believe this is a CAT scan. It may be an MRI, but it's a scan of our brain that shows how much activity is happening. So on the left, for the placebo, that's our normal state. We're not using all of our brain. We're using just like the habit parts of our brain. We're using these connections that we use all the time. When our default mode network goes offline, our brains look like what's happening on the right, which is more connections are being made across our brain. The silos of our brain are communicating more. It's almost that our habits get taken offline, and so now we need to figure things out from a fresher perspective. And then what we've discovered is that when ego dissolution happens, it's when our default mode network goes offline. And so we need ego dissolution in order to be able to see things from a new perspective, in order to be able to access parts of our brain that maybe, so let's just say, for example, I have a trauma from my childhood. Well, my brain is probably going to do its best to avoid wherever that memory is stored in my brain. It's going to try to go around it as much as possible in order to help me function better. It's a natural process that we do to protect ourselves. Well, once the default mode network goes offline, I have access to that part of my brain, and I can actually now dive in to some maybe past memories that I maybe couldn't access before, but do it in a way where there's no judgment, there's no criticism, so it feels safer. I'll just give you a little bit about myself. So one of the things that I was very fortunate in my journey. So I was diagnosed with major depression, and I was on antidepressants for 25 years. I've been off of them for a year now, since with psilocybin, and I do not have depression. I always believed depression was hereditary, but what I realize now is it's not hereditary. It's modeled. It was modeled. It was it was like I was conditioned. How do people deal with life? Well, I always watched everything happening under depressive umbrella, in addition to my own trauma. So what I discovered is that my depression was actually unresolved trauma. And once I resolved it all, my depression went away. But one of the things that happened during one of my early journeys is when I was 5 years old, I spoke fluent Spanish. My grandmother was from Mexico. But because I look very white, she actually didn't want me speaking Spanish. So she stopped speaking Spanish to me at 5. On a journey that I took when I was reliving my childhood memories, I was able to access that part of my brain. And now I can speak Spanish. Hablo español. In fact, it's like it opened up that part of my brain and all my Spanish came back. It is 5-year-old Spanish, mind you, but it opened and unlocked it. And when the treatment was done, my Spanish remained. So this is what taught me that this slide actually happens. The fact that I was able to recover all this Spanish that I had, that could have, that proved to me that my brain was accessing parts that it doesn't normally access. So they're also learning that resetting of the default mode network, which is what happens with psilocybin, there's a resetting that happens. So when you flood when you get the default mode network offline, your brain gets flooded. When it comes back on, it's almost like it's been reset. And so they're starting to examine, maybe that's part of what is linked to the antidepressant effects of psilocybin. There's this resetting that happens. So you're now going to be using different pathways that were opened up during the treatment. And so then that's possibly why a lot of people are getting off of antidepressants and anti-anxiety meds. So there are different types of treatment using psilocybin. There's 2 in particular. There is the spiritual treatment, and then there's the therapeutic treatment. So the one on the left is very, it represents the kind of retreats that you can get, like in Costa Rica and Jamaica, where they tend to be led by shamans. They're very spiritual, they're done in a group setting, and they can be very powerful. On the right, this is what the clinical studies look like, where it's, an eye mask, you're internal, you're in a room by yourself with guides, you're not sharing your experience with other people. I'm not going to say one is better than the other. I just was trained on the therapeutic route, the clinical model, which is the one that I do. I feel that's better since I am not a shaman. I'm not going to try to represent myself that way. I think it's awesome for people that have that background. That's just not where I am. So I actually do the what looks like more on the right, only it's not exactly like that. We don't have 2 therapists holding your hand the whole time. But we are doing things with, we have an entire protocol that we follow where we have intake sessions beforehand. You have your group meeting the day before for setting. Then we have the treatment and then followed by integration, which is absolutely critical. And I'm going to talk about that here in a slide. So here's the stages of the treatment, the clinical model. There is pre-treatment assessment and preparation. This is absolutely critical in order to make this successful. It's important that you do an assessment for contraindications and risks. It's important that we establish setting, and matrix. And then we also do intention setting. We're not just going to throw you in. We want to see, what do we want to work on? What are the focus? What's the areas of focus that we need to develop in order to make sure that when you're doing this treatment, we as guides are going to prompt you with your list so that you make sure that you don't forget to deal with the things that you're wanting to actually gain healing and clarity around. Then after the treatment, I already mentioned integration. Integration is absolutely critical. It's just as important as setting. There is neuroplasticity happening in the brain for 30 days after the treatment. And so we take advantage of that for permanence in order to change the behaviors that an individual. So basically, during their treatment, there's new thoughts, new feelings, new understandings. But we want to make sure that those get integrated permanently so that you're not feeling like, well, shoot, I went through this whole experience, but I just ended up going back to my old ways because I wasn't given the extra care that is required around integration for permanence. The studies show that if integration is not done, people can go back to their old ways, which only makes them feel worse because now they've lost hope. So integration is key. So just a real quick, here's a list of the contraindications and then some of the risks that exist. Obviously, if you're pregnant or breastfeeding, I actually am not 100% convinced that it will hurt the baby. But I'm not going to be the one to test that. I'll wait until there are studies. For best practices, I want to make sure that everybody is safe. If you have any severe mental health disorders, this probably is not going to be the best modality. If you have unmanaged diabetes or epilepsy, if you have severe cardiovascular issues, these are all things that do need to be taken into consideration. There are some also risks with SSRIs, also with, like I said, the cardiovascular issues. If people have, like, maybe they're taking blood pressure meds, but it's managed, then it's probably just going to be fine. It's when you have severe cardiovascular issues that it's an issue. So interfering conditions, competing for the same receptors is going to be antidepressants and antipsychotics and anti-anxiety meds. Things that will significantly affect your experience are going to be benzos, opiates, and then also there's some things that can interfere, such as stimulants, antacids. There's also things like dairy products. There's a few things that we give precautions about to people doing the retreats to make sure that there's going to be, so that they have the best experience possible. If they're on any antidepressants, anti-anxiety meds, and antipsychotics, it will compete for the same receptors. And if they're taking these meds at high doses, you probably won't have an experience. So it is best to wean off of these medications under a doctor's supervision, preferably 2 to 4 weeks in advance. Microdosing, I just want to make sure that I just briefly talk about microdosing. This is something else that we offer in addition to our retreats and trainings. We have found that microdosing has some pretty amazing effects. It's really sad because the studies right now don't show microdosing as being any more effective than placebo. But I can tell you firsthand and secondhand, I completely disagree with that. I think that microdosing can really make a huge difference. But here's the key. It can't be done on your own. You need to be coached and guided through the process. If you see down here on the right of the slide, April Bennett, she is an amazing plant therapy life coach that works with me. She is on my team. She's actually on this call as well. If you have any questions for her, she'll be able, hopefully, to answer those questions as well. I'm kind of putting her on the spot there. If not, I'm happy to answer them. But we do offer plant therapy life coaching and microdosing as well. And this has been something that can be life-changing for people.